Hi, I'm Shahnaz. I'm from Shahnaz Interiors. We are a design and build contractors for healthcare. So today's topic will be about new patients experience and the design principle that all healthcare facilities should follow. So to start with, a brief introduction about the mantra of healthcare design will be safety, technology and comfort. As a designer, we need to be very bold in demanding this aspect so that we get the value engineered out of a project. As a designer, we need to be accountable to the metrics and need to show how the built environment can actually impact health in a justifiable, measurable way. Healthcare providers then need to have the relevant information to justify the design division. This is so very important to use evidence to influence the design of healthcare facilities as how the industry is quantifying and optimizing patients' experience. It all starts with patient-centric environment. What is patient-centric environment? It's about patients are becoming partners to healthcare providers and about providers not just treating patients for clinical perspective but also considering emotional, mental, spiritual, social and financial perspective. There are 5 ways to achieve patient-centric environment, which are: number 1, residential. For any healthcare spaces to be considered safe and welcoming, it must include familiar comforts of home as well as offering a sense of hospitality. For example, the seating doesn't have to be too stiff or rigid, but maybe have a softer padded PU to make them feel more cozy. When a hospital feels too institutional or clinical, patients are more likely to feel anxious and upset, which would negatively impact their healing. Number 2, biophilic design, which incorporates nature, eco-friendly component into indoor commercial spaces, which with an excess of natural lighting, vegetation, organic texture, patterns, water and refreshing airflow. Rooted in science, biophilic design creates multi-sensorial experience to reduce stress, improve cognitive functions, stimulates creativity and instill calmness. Number 3, modern technology. Personal technologies, particularly wearables, are pushing the care and well-being into people's conscious mind. In the next decades or so, this technology will create a robust virtual care environment that will be accessible nearly anywhere, bringing care closer to patients. With this, workspaces for healthcare providers need to adapt to the additional greater diversity in space type, including visual consulting, which require private technological connected spaces. Number 4, evidence-based design. All interior design material selections remains critical to ensure that the space is safe and caring while offering the best scenario for positive outcome. Why? Because there is an increase of healthcare associated infections within the healthcare spaces. Then how do people feel safe is about choosing the best easily disinfectant while standing up to newer and more stringent cleaning disinfecting protocols. For example, perhaps we can use iron-infused countertops, antimicrobial coatings on door handles, indigo lighting technologies in surgery department to fight bacteria in a very sensitive environment. Number 5, facilities and amenities. Spaces in healthcare needs to be more accommodating and inclusive. Patient demands more of their physical and virtual experience. For example, perhaps we can offer augmented coffee space, double seats for social opportunities, and encourage family groupings. Maybe we can have child play area at waiting area and it is a must to have charging stations for mobile device at waiting areas. Branding. Why is it very important that healthcare facilities have their own branding? Because it's very competitive nowadays, and they should have a consistent and uniform appearances that should be practiced in the management and across its chain location. This would result in creating a stronger brand, increasing trust and familiarities that distinct its image from its competitors. Why is it important to have branding? Because the benefit of giving the sense of belonging to the patients cultivates loyalty in their hearts, give a lifetime loyalty to the hospitals, also increase patients' referrals, would then results in bigger market shares and stronger financial performance. With this, our humble design consideration that all hospital administrators and medical centers professionals should now rethink of the design that they need to consider in their healthcare facilities. These are among the trends that is globally accepted. Number 1, facade and exterior design. They are often undervalued, whereas building faces could actually give a positive first impression. It's all about making a positive connection with the patients, also taking advantage to create a long-lasting memory. Nevertheless, architecture of an exterior building can actually be planned in such a way that it reduces consumption of a building, energy, operations and maintenance costs. A facade of a hospital building is more than a show. It contributes the healing of a patient as well as having a greater impact on their well-being too. Number 2, color of a healthcare. Healthcare facilities such as hospitals and doctors' office can cause overwhelming stress and fear. Sometimes these feelings are induced by self, but sometimes the settings are amplified in such a way because hospital rooms are focusing on frightening the patients in depressing white walls. With this, we use a distinct color scheme of orange throughout one of our projects as waiting room, actually to create the sense of warmness, encouragement and life in what can be a sterile and cold spaces. On the other hand, we offer serenity and calmness for patient rooms so that they can be peaceful and pleasant by using a pastel colors. Number 3, wayfinding. At macro level, wayfinding signage should complement the building and interior design, but at a macro level, the brand graphic, destination terminology, management language should be consistent with the current identity design. Number 4. Holistic design approach. There should be a continuum path to recovery throughout 3 stages in patient's experience, which is anticipation, transitions, and healing. Hence, facilities must provide patient with access to outdoor and spaces for natural lights, integrate views of nature while they are waiting for their appointment. On the other hand, when it's not feasible to have vegetation in certain areas of a healthcare facilities, then we can consider having artworks or even earth color tones on finishes walls and floors. Number 5. Technology is quickly approaching the true plug-and-play level of integration for an entire building. Hence, planning for technology must be forefront of any facility project to ensure that it will be relevant to future care delivery. As such, design community need to be quick to adapt within the facility areas. Number 6. Flexibility. What did COVID-19 teach us? It is difficult for healthcare sectors to fully predict, let alone prepare for the future. As such, we encourage the use of prefabricated partition, which may take less time to install than traditional walls, but then it can be split into large exam room or even split into smaller rooms when necessary. Maybe we can have shell spaces, a temporary placeholders for future expansion. And our suggestion, we can have movable modular rail storage systems where it actually stores glove dispensers and accommodate materials that physicians use during patient's exam so that it can be used during emergency times. With all that being said, patients now have more access to ranking, comparisons, data than ever before. It is still hard to know what doctors or organization is good for them. So what they do is they rely on their experience and judgment instead. They might not know about organization percentage of mortality and morbidity, but they often look at more subjective measures like whether they are listened to, comfortable to, if the environment is more pleasing to them. Although I understand that it may be quite challenging and it might be expensive to actually work on the existing facilities. With that, our advice is to encourage the existing facilities to conduct survey to patients to understand the shortcoming in their existing facilities. With those, we can then have responsive features in our own design to accommodate such feedbacks. Feedbacks are actually goals. Frankly, I never had any hospitals coming up to me and actually talking to me about my experience in their facilities. So, when it comes to renovating any hospital, the main focus should be to improve in order to achieve desired outcomes. Here at Shahnaz Interiors, it's all about building smarter healthcare interior designs. So thank you so much for your time. See you.